Hi everybody, this is a video about possible flares from a few different substances. Somebody posted a question on one of my other videos asking about flare-up reactions and whether I've seen certain things flare people in practice. Just before I get into the meat and potatoes of the video here, if you don't mind taking a quick second to like or comment or share or subscribe to my channel or video or whatever it is that's appropriate given the given medium that or social media platform that you're watching this on. If you could just take a quick second to do that, that would be great. Thanks. Even just a quick comment of like, thanks for the content or something like that just helps my social media channel, and I really appreciate it. So thanks in advance if you can take a minute to do that. So I'll just read the question here. There was a bit of a preamble to it, but the nuts and bolts of it is, do I think that either DMPS or alpha-lipoic acid would be likely to flare patients? Or the person asking the question was on a forum, and people are talking about getting flared from these substances. So is that likely to flare patients, or is this the 0.01% that might flare from this? So as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your healthcare provider to get that medical advice. In my experience, my extensive experience having administered or asked my fearless, tireless residents to administer intravenous DMPS, and I've used oral DMPS as well, literally thousands of times over the years. It's something that I've seen to be very, very well tolerated by and large. There are definitely some patients that have some flare-ups from it, but it's generally very, very, very well tolerated. So yes, it can flare, usually doesn't. Alpha-lipoic acid, I've recommended that as an oral supplement countless times, generally very, very well tolerated. Very few patients that I've seen who have reacted negatively to it. And we've also used a fair bit of intravenous alpha-lipoic acid over the course of time. Not a ton of it because I just haven't seen a whole lot of clinical benefit except in certain niche populations, specifically folks who are suffering from neuropathy. It can sometimes be very helpful in those cases. Sometimes when there are liver pathologies going on, it can be very helpful. Don't really see a whole lot of additional benefit over and above that in my experience, and generally very, very well tolerated. There's always patients to react to just about, I've seen reactions to almost anything you can possibly imagine, at least once or twice with certain patients, but with alpha-lipoic acid, very, very rare to see any side effects from that or reactions. Further question here is, does intravenous NAD flare patients? So NAD being a specific form of vitamin B3. So we've used quite a bit of IV NAD over the course of time. I've posted some other videos about this. It seems to have quite an infrequent beneficial effect in my patient population, unfortunately. So I don't really use it a whole heck of a lot, but we have run a number of treatments over the course of time. With IV NAD, there are side effects that can come up during the treatment itself, notably shortness of breath or chest pain, which goes away almost immediately as soon as the IV is slowed down or stopped. But outside of those reactions that happen during the actual IV itself, I haven't really seen it do much of anything. Again, some patients it's been helpful for, but usually it doesn't seem to help or hurt. Just seems to be a big fat neutral for most of the patients in my experience. Then there's another question here, and I do enjoy these rapid fire, so bring them on. It's great. Separately, do I think that taking oral NADH capsules is effective for energy production? So NADH is the exact same substance, just the NADH is in the reduced form, so just a slightly different form. I've played around with NADH capsules. I've had a couple of patients where they've been helpful, sometimes just a little bit helpful, sometimes very helpful, but I've found the vast majority of patients it has not really made much of a difference. Now, I've probably tried them with maybe 20-ish patients, and had maybe 2 or 3 out of those 20 who seem to benefit. One patient I have, she still works with them because she finds that they really help her, but generally not very helpful. So I used to have this other form of vitamin B3 called nicotinamide riboside, or NR for short, in my mitochondrial support formula. So it's another kind of fancy pants form of vitamin B3, and just didn't really notice a big change if that's in there or just plain old niacinamide is in there. So I have not really been blown away, unfortunately, with these kind of fancier renditions of vitamin B3. And are there precautions or certain groups who should not take NADH? I mean, possibly, and this would be a good thing to talk to your healthcare provider about. Generally speaking, there aren't these, to my knowledge, any glaring contraindications with for example, people who are on any medications that increase serotonin in their body, like SSRI medications, it's a big contraindication to take that along with, say, methylene blue, which is, it's a strong antioxidant supplement out there. So that's like kind of a big like black box, warning label kind of thing. But with NADH, there aren't like big flags like that, but there could certainly be individual things that might preclude a person from being safely able to pursue NADH therapy. And then which is more effective, NAD or NADH? And unfortunately, in my experience, as I've alluded to here, neither. So they're both equally ineffective in my experience. Unfortunately, we've used IV NADH as well. To my understanding, that's not available in the United States, or at least it wasn't for a while. And but we've been able to get it in Canada without any hindrance. And yeah, NAD, NADH, like just really very, very few patients benefited from it. So both equally ineffective, in my opinion. If anyone listening has had positive experiences with NAD or NADH, please include that in the comment section below. I'd like to hear about that. I do always, when I'm asked about this or talking about this, I do always ask like, hey, like tell me about positive anecdotes. I ask colleagues about this, and it's relatively infrequent that I hear really positive anecdotes. And when I do hear positive anecdotes, I like to ask the question of, okay, so like you were doing the IV NAD, and then like, were you doing anything else with the patient? Yeah, of course, we're doing this and this and this. Like, okay, great. Of course, use multiple things. But kind of asking the question of, how many patients have you had where they're on a certain protocol, their energy levels or their neurological symptoms or their pain levels or whatever it happens to be have kind of like hit a plateau point. So you keep them on the same protocol, but you just add in IV NAD, do several treatments of that over a span of a few weeks or several weeks. And like, have you noticed a difference with that? And in clinical practice, sometimes it's hard to set up that type of scenario where it's like, well, no, like I kind of started them on everything because I want them to get better faster, and so they're feeling better, and I'm assuming that the IV NAD is part of it. Like and maybe it is in those cases, but I also wonder, like, maybe it's all the other stuff that you were doing. So to kind of get that really unadulterated information about, is this NAD actually making a difference? Like that's the kind of setup that I feel like it needs, and that's what I'm basing my opinion on. Where I had the patients that I did recommend IV NAD for, we were already doing the other things, and then we added in the IV NAD as the only new variable, and then we saw how the patient was doing, and it just really didn't move the needle very often. So that's where I'm coming from with that opinion. So thank you for the questions. You submitted another question too, but I'm going way over time here with my video. I'm already up to 7 minutes and 45 seconds, so I better end it there. I'll answer your other question later, and if anybody has questions about this topic or anything else, just post in the comment section below, and I'll do my best to answer as soon as I can.